This is Richard RJ Eskow, and we talk a lot about Medicare for All on this program. We are for it. Make no mistake about that. And one of the things that's interested me, well, there are a lot of things that interest me about the topic, the politics, the economics, and so on, but we don't talk enough about the medicine part and how people, especially physicians, come to become dedicated to this cause as well. So we'll explore that and some perhaps related issues now with our next guest, Bill Honigman. Dr. Bill Honigman has been and was a practicing emergency room physician in Orange County, California for more than 30 years, and he's been active in Democratic Party, his politics, it says here, since his youth, which I'm going to guess was about 30 years, given his timing on his career. He's currently an organizer for the grassroots group, the Progressive Democrats of America, or PDA. I know those guys. I like them. They're a good group. You should check them out. And he's acting as California State Coordinator and Orange County Chapter Leader and Coordinator for their National Healthcare Human Rights Issue Organizing Team. So first of all, Bill, thank you for coming on the program.
Thank you, Richard. Great to be with you.
Great to have you. And did I get all that right, more or less?
Absolutely.
Okay. All right, good. So one of the things that interests me, you've obviously been political your whole life, so it's not like, something in your medical practice, I would guess, made you political. But how did you see, we're always talking about the economics and the politics of Medicare for All. Maybe we'll get to that here, but, how does those two sides of your experience come together, the activist side and the physician side? I mean, emergency room medical care is as intense maybe as it gets in the medical profession. Do you see an intersection between the two? How did your political eye view your medical experience in the ER?
Well, absolutely it does, and thank you for focusing attention on this. My personal story is that I was raised by a family medicine physician and a nurse, so I have medicine in my family background. I used to accompany my father on hospital rounds and in house calls in the neighborhood, and so I remember when the practice of medicine was very personal and interactive. And there was a lot of trust and faith between patients and physicians, and nursing, obviously, in the hospital setting. I went into emergency medicine because it seemed more exciting. As you might imagine, I saw myself as someone who could fix perhaps problems that people had, would come into emergency for in the middle of the night. And in fact, it did that, but it also showed me that over the years, at least, we've lost that patient-physician relationship. So that, by design in my practice, I would only see people once, perhaps, ever with their emergency room visit. But over a period of time, even, I realized that patients weren't seeing their own personal doctors that much more. They were coming in more and more for basic medical needs into the emergency room. And my other side is that I have political activism in my blood as well, and been doing it, far back, I think it was the third grade. I can remember walking precincts in my neighborhood for school bond measures that happened a lot here in California at the time. But I've been active in the Democratic Party, and I'm proud to say that the California Democratic Party has had single-payer healthcare, universal healthcare in a form for over a decade because we've worked so hard to do that. And then what this results in, the combination of the two has been frustration amongst a lot of us providers. We see people who fall through the cracks and end up in emergency, with conditions that could have and should have been treated much more effectively and preventing the complicated healthcare outcomes that they had in emergency, like the ones we all know about: diabetes, high blood pressure, ends up in heart attacks and strokes if they're not well controlled, but even relatively simple things like dental infections. Practically every night in my ER shift, I would see someone with a dental infection because they were putting off getting care for it. So that's not right. In all civilized countries in the world, they take care of things like that. And, especially in this country, the richest country in the world, we should be taking care of things like that.
Well, I couldn't agree more. And Bill, you raise two or three important issues there. I mean, one is that when people don't have health insurance in this country, sometimes the only primary care they can get is by going to the ER, where they can't be turned away. Although hospitals, as you well know, are trying to do things about that now. Or they don't treat a medical condition until it achieves something like emergency status, and then as far as dental care is concerned, it's horrific when untreated dental conditions turn infected and so on. But we have this, one of the great things about Medicare, the Medicare for All proposals we're all supporting, is that they include dental, because it's a very odd kind of way to look at the human body, that the mouth is somehow not part of the body that should be insured. It's one medical system, right?
That's right. Yeah. In fact, former Congressman Alan Grayson, I hope he gets back in Congress. He put forward a bill he called "Seniors Have Eyes, Ears, and Teeth." So that was designed to enhance Medicare that a lot of us have now, to include dental, vision, and hearing. But we need to go way beyond that, obviously, including long-term care, including mental health services of all kinds, including alcohol and drug rehab. I mean, all those things are so essential, and are putting this country at a competitive disadvantage, around the world. So other countries are attending to these problems, and we're not, because the cost is being shifted onto individuals. And, this is the kind of thing, healthcare is the kind of thing that we can do better as a group than any one person can do by themselves. So, whether it's schools and education, public transport, court systems, the postal service, all of these things are services that we can do better as a group than anyone can do by themselves. And that's absolutely true, I'm convinced, in healthcare as well.
Well, I think there's no doubt about it. I think there's been a lot of economic research to confirm that. And Dr. Bill Honigman, the other thing that comes to mind when I think about Medicare for All, well, many things come to mind, but one of the other things that comes to mind is mental health care. I'm sure in the ER you saw lots of folks who were there as a consequence of some form of untreated mental illness, and in a variety of different ways. We have the same kind of weird distinction, that, in my opinion, weird, that we make between physical or transparently physical ailments and mental illness, which can often have a physical source as well. And I don't know what your thoughts are on mental illness in Medicare for All, but I certainly have some. I'd like to know yours.
Well, our treatment of those who have a mental health illnesses, conditions, is completely inadequate, in my opinion. And again, I'm biased. I see people who end up in the emergency room who are not being well treated, and we end up being a warehouse for those folks. People stay there for days on end. Will stay in the emergency room. Homeless people, I think it's estimated 25% of our homeless have untreated mental health conditions, including another 24 or 5% who have alcohol and drug-related issues that are untreated as well. So our emergency rooms are really kind of a staging place for those affected with those conditions. Which is not what the ER is supposed to be doing, not what it does, again, in every other civilized country in the world. And that's, again, shameful.
Yeah, I wouldn't describe you as biased for having that experience. I would describe you as well-informed, better informed than the average person. So you are coordinating healthcare as a human rights, as a human right, as an issue with Progressive Democrats of America, PDA. So what are you guys doing? What is your work in the area of Medicare for all and healthcare as a human right?
Yeah, well, thanks. And people can get more information, of course, on our group, Progressive Democrats of America is pdamerica.org. And on the issue side, this group referred to as peopledemandingaction.org, also People Demanding Action. You're absolutely, everyone is welcome to join our healthcare team, where we have monthly discussions by phone and, of course, ongoing online. But our effort is to work in coalition with the terrific groups that I'm sure you're aware of and have had on your show. People like National Nurses United,
Sure.
Physicians for National Health Program, Healthcare Now, the Labor Campaign for Single Payer. We're working in concert with all of those groups to push forward the concept of healthcare as a human right. And we know that Medicare for all is polling better and better. So, how are we doing that specifically? PDA's focus has been on the electoral process. In those two groups, PD America, Progressive Democrats of America, we actually endorse and support candidates who run on that issue in their campaign. Many of them were successful, as you know, in the last election. And then also to support those progressives in office. It's unfortunately exclusively Democrats at this point, but those in office who support it as well. And then on the issue side, we support and participate in forums and town halls, movie showings, whatever it takes to continue to raise awareness, canvassing. I know the National Nurses have a program coming out now. It's rolling out right now for what they call barnstorming across the country. Again, to raise awareness and canvass and have actual person-to-person contact, which will result in more voter engagement for the next election cycle. So that's exactly the kind of thing we're engaged in.
Well, I like your group. Your group is doing great work. I like your cause. We're big supporters of Medicare for All here. So Dr. Bill Honigman of Progressive Democrats of America, thanks so much for bringing your experience and your insights to the program. We're glad to have you.
Thank you, Richard. Great pleasure to be on with you again.